doesn't care if you're black or white. Mental health doesn't care if you're gay or straight. Mental health doesn't care if you're a man or a woman. Mental health doesn't care if you're rich or poor. Mental health doesn't care if you're French or English. And mental health doesn't care if you're a conservative or even a liberal. It affects us all. And I think it's important that as we gather here in the seat of government, that we can begin a dialogue about the importance of mental health and to continue the conversation. Alex is my stepson, Karen's son. Alex died by suicide on April 1st, Easter Sunday, 2018. And Karen and I, from that very day, decided that we would honor Alex's name by being open about the circumstances of his passing. So we continue to be his voice in terms of this discussion about mental health.
Hello, everyone. Welcome to Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. By age 40, about 50% of the population will have or have had a mental illness, according to the Canadian Mental Health Association. The Carion Fenn Foundation joined force with City of Pickering Mayor Kevin Ash and his wife, Karen O'Brien, to help support the community and honor the legacy of their son, Alex Monahan. Throughout this episode, I'm going to present you with exclusive videos of the Alex Monahan Queen's Park Mental Health Chat, the first Queen's Park Mental Health Chat in history on behalf of the Carion Fenn Foundation. We want to help you learn more, so let's learn together. Mike Shoreman, mental health advocate, is here with me, and we are going to have quite a conversation about mental health, and he was actually present at Queen's Park. Mike, you have done so much work. I see you all over the place talking about mental health and why it's important to talk about mental health. Why is advocacy important to you in mental health?
Absolutely. So first of all, thanks for having me. Always great to see you and to connect. Why is advocacy important to me? I think advocacy should be important to everybody. I think that we all have a role to play in the mental health crisis that we find ourselves in. Mm-hmm. And the more awareness and the more education that is created, the less stigmatized those who experience mental health and mental illness go through. There's less shame and guilt and less pain for those who experience it. And while 1 in 5 will experience mental illness, we all have mental health at varying degrees. Yes. On a scale of 1 to 10 every single day. So it is a part of our physical, makeup, and it's an important thing to bring attention to.
Yes. And I think it's so important. When we were at Queen's Park, having conversation with the MPPs, and I remember one of the speakers, Dr. Shamji, I believe he is one of the critics for the Liberal Party, and he spoke about the experience being a family doctor and an emergency doctor, and the importance of having the proper care. I think we need to get rid of the stigma in terms of people being ashamed of asking for help or needing support. We're looking in the area of how males are accessing service or having conversation about mental health. I think this year around, we are going to put more male speakers because I think it's important for males to see more of themselves out there having this conversation. What's your thoughts around mental health when it comes to men? I think we lost a young man in Pickering recently. And it's a devastating thing for the family and for community to know that, someone passed away like that. The big worry is, what can we do? What's your thoughts around men and mental health?
No, absolutely. There's an added layer when it comes to men talking about what they're experiencing emotionally and psychologically. I just did a TEDx talk that recently it
Mhm.
was released at the beginning of Mental Health Awareness Month. You can find it online, but I speak about the barriers that people face
Mhm.
with accessing mental health services and treatment, and even just communicating it and vocalizing it.
Mhm.
There are so many barriers in place, and part of that, is fear.
Yes.
Fear that is driven by our society, by job loss, potential job loss,
Mhm.
and being viewed as less than or
Mhm.
weak.
Yes. So COVID, we're outside of COVID now. Are we, do you think that um the temperature of mental health is kind of not being so out of control? Have we gotten, do you think society have gotten control of the emotional impact that has happened, that was caused as a result of COVID? Are we getting better?
um, I think that we're taking steps to become
Mm,
better.
yeah.
I think that this is what's needed is a united front.
Mhm.
And until we have every single person believing in mental health and fighting for it, same, it's similar with climate change.
Mhm.
You don't achieve something on your own. You need it's a multi-level, multifaceted, complex issue that takes a lot of work from governments, from individuals, from media, from all corporations and businesses coming together to address these issues. And the fact remains that one fifth of our workforce
Mhm.
is struggling, and that's inside the workforce. There are people who can't even get out of bed in the morning, um, to who aren't working. But when you have one-fifth of your workforce struggling,
Mhm.
that's an alarming stat.
So, how did you transition from going through the process of crossing the five Great Lakes, then go back into a regular routine?
Oh, that took quite some time. I took time to decompress.
Mhm.
I think a lot of people have, well, the book's coming out in the fall, and that will detail it. But the behind the scenes,
Oh, you weren't gonna
the
give me any of your secrets from the book? No.
no,
I thought we're friends. I thought we're friends, Mike.
uh, no,
Exclusive.
the emotional and the psychological stress,
Yeah.
being in fight or flight
Mhm.
for you know 10 months, a year, with in the lead up to that. And there was you know a lot of pressure,
Mhm.
and to go like that for so long and then to come out of it, there was a huge crash. I wouldn't say that there was a depression,
Mhm.
but there was definite, you know moods weren't stable all the time.
Yeah, yeah.
And it took me a long time to bounce back from it. Took probably about a year.
Wow. That can definitely take a toll, especially when you're in that mode and state for a long period of time, and then you're back to doing the regular things that you do. Sometimes you feel like you're back then, and
Mm.
you're back in your regular life. In terms of where are you speaking next?
This week I'm speaking, I'm doing a workshop with Canadian Border Services. That's on Wednesday.
Mhm.
So it's really great because I get to work with a lot of government organizations. I do a lot of corporate work. I do work in educational institutions, but this week's kind of nice because I get to work with the Canadian Border Services. So it's government. These are people who have to deal with the public every day. It's a federal government organization. The government generally, hasn't had the best track record of implementing mental health workshops.
Mhm.
So it is good to see that steps are being made. This is the third time that I've worked with them in this capacity. And then at the end of the week, I'm heading out to British Columbia. And I am keynoting at the 34th Annual National Suicide Prevention Conference in Vancouver.
So what is it like when you're actually at a conference or a speaking event? Are you living the rock star moment? How is that? Do you get to be Mike, or are we looking at superstar Mike?
No, we get to, it's really not, I get to do a lot of traveling now, which is nice. So the benefits of that are that I get to see friends and family in different places all the time.
Hmm.
You know, it depends really. Vancouver is a very fast turnaround for me. I'm speaking on the 29th. I'm in Waterloo, Ontario in the afternoon on the 30th, so I'm taking the red eye home. But
Hmm.
I do fly in a couple days earlier, so I get to go for some nice walks. I'm gonna be out on the ocean. I'm gonna have some nice meals out of Vancouver. But really, it's a get down to business. They're having me come in to do this. This is a 90 minute keynote with Q&A.
Hmm.
So I take these very seriously. I'm in rehearsals all week with this.
Hmm.
Part of that is blocking off this entire week in preparation. So everything runs smoothly, and then the day of, I present in the afternoon. I'll wake up. I'll probably go have breakfast at the conference with people, and then I'll go back to my room, and I'll be in rehearsal mode that day.
Hmm.
Maybe go for a nice walk on the seawall in Vancouver, and see the mountains, and just kind of get into my zone.
Okay, that's wonderful. You're watching Health 180 with Carion Fenn on Rogers TV. We'll be right back.
Anxiety, depression, childhood depression is a lifelong condition. These are lifelong conditions. They don't end when the child turns 18. They don't end when the child goes to high school or goes to university. They get carried on.
This program is.
We've heard this morning that mental health is not addressed the same way as physical health is. And while we have come a long way in the last 10 to 15 years, if you look back 10 to 15 years ago, we are not where we were. We still have a long way to go. And stories like Alex's remind us how far we have to go still. The need has never been more important for critical mental health supports provided by organizations and services that we all rely on. Mental health doesn't affect the person who has the challenges or the illnesses.
When a person dies by suicide, on average, it impacts over 100 people. And that's just one person.
Welcome back to Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Mike is back with me talking about mental health. Is health really mental health really health, Mike?
Absolutely. So our health encompasses both our physical and emotional well-being.
So in terms of shifting attitudes and behavior, what is your thought on that?
Absolutely. So, I think the tide is turning with how we view mental health. What we're having conversations now that we weren't having 5 years ago. We're having conversations now that we weren't having 10 or 15 years ago. Things are changing. The thing is, when we look at how we approach an issue, and it's such a big issue, you don't see huge change right away. It often takes time. Just talking about, I did a presentation with the Canadian Armed Forces in December. It was the first time that they'd ever had a mental health educator in. And that was shocking to me. But when you're looking at an organization that, it's so strict and rigid, and to have anything passed has to go through multiple layers of sign-offs. It was very encouraging to see that yes, they are committed to change, but that change isn't going to be a sweeping change overnight. It takes continuous effort, and by people within the organization, and that's just talking about within one organization. Then we're talking about mental health within our region, within our cities, within our region, within our province, within our country. It takes time. It takes time, but we are. I do believe that that people are realizing that mental health is important. Would you rather lose an employee of your, if you own a business, if you own a company, would you rather lose an employee because they're struggling with their mental health and retrain them, or would you rather address mental health in your workplace? Because if you're going to address mental health in your workplace, you're going to retain people, and it's going to cost you less to replace them.
Yeah. I think that's so important. And for Mental Health Awareness Week, City of Pickering invited me over with their staff. They actually have a wellness committee inside of their establishment. And the committee wanted to engage, and we were able to have a table and interact with staff as they were going in and out of their office. And it was incredible to see the conversations are the same as what we're having, at church, at school, different places. I think sometimes we tend to not realize that, the work environment, these are regular people. And, we need to provide the platform, because you get better outcome out of workers when you're helping to support their mental health. And it was just a wonderful experience to see the participation, the engagement, and actually for a workplace to have a wellness committee that's looking out for their emotional health of each other and supporting each other. So that was really wonderful. And I think we need to see more environment where, we're focusing on supporting mental health in the workplace. I think that is
absolutely.
Yeah. And sometimes it takes a bit to pull the organization in the right way. But, like you said,
It does. So I addressed that in the new TEDx talk that just came out. I addressed that using the 1 in 5 mental health statistic. You can find it online if you go to YouTube and look up Mike Shoreman TEDx, but it looks at the mental health statistic, the 1 in 5, and how we always focus on the one.
Yes.
Well, there are 4 other people in that equation.
Mm-hmm.
And that equation is in our places of work, in our schools, and in our communities. These are people who we work on projects with. These are people who we report to. These are people standing in front of us or checking out our groceries at the grocery store. And we don't even know.
Yeah.
So, in an overburdened healthcare system where people are struggling to find access to treatment, if they even go to get treatment. The idea is to switch the focus, building support systems, because that's what we need. We need support.
Yeah.
Building support systems of 4 to 1 within that mental health statistic. In our places of work, in our schools, and in our communities, so people can go and get the support they need, not by a psychologist or a psychiatrist, but by people that we have in our lives as cheerleaders, as allies, as go-tos for additional support.
I was looking over the video from Queen's Park, and I was listening to Minister Bethan Falvey when he was speaking. He mentioned, there's a quote he mentioned. He stated that the measure of a society is how you help the most vulnerable.
Mm.
And I thought that was very touching.
Mm.
You don't hear people really talk about things in that manner. And I think to hear, especially the finance minister, making a statement like that, and it's true. What's your thought? What's your thought on that statement?
No, absolutely. I think, we, if you can help,
Yeah.
whatever it is,
Yes.
whatever, if you have the capacity to help someone, you never know what that person might do with that.
Yes, that's true.
So, whenever you can, jump in, say
Yeah.
yes. Try to say yes when you can.
We had breakfast at Queen's Park, which was really early in the morning, and thank you for being there. We are actually this year we're having lunch because breakfast was a little bit early. So we're having lunch this year. Tell us, what was that like being at Queen's Park for the breakfast we had? We had the Alex Monahan Queen's Park Mental Health Chat breakfast with the MPP. We brought some organization, community members, experts to interact with the MPPs to talk about what's going on in Durham region and what support is needed. What was that experience like for you?
Yeah, no, it was really great to listen to different perspectives. I think it's always important to listen. It's actually more important to listen than it is to talk most of the time.
Yeah.
we get lost in that. So it was nice to see different members of the different political parties come together
Yes.
to recognize
Mhm.
and to share, their experience, what they're seeing, and then of course, to speak with the different leaders and the different organizations, to have them in a room, is always, beneficial. Having collaborative meetings like that, uh, it's always beneficial.
Mhm.
What comes out of that, um, you know, because from there, we all have good thoughts, right? Or we all think that we do. But when you put people who are decision makers and leaders into a room together, that's where the magic happens. So I think that what I observed was community coming together, and essentially leadership at its best.
Yes. And I think what was most notable as well was the fact that there were members of provincial parliament from all parties. There were ministers. There were the MPPs really came out to show support, and it being the first mental health chat at Queen's Park, I think it was important to see that, and it was great to have you there as usual. Thank you for coming on the show, Mike. I can't wait to see your TED Talk.
Thank you. Thank you for having me.
You're watching Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Thank you to Mike for joining us, and thank you for joining. And remember, together we're stronger.
You know, mental health and addiction it touches everybody. I don't care who you are. It touches our families. It touches our brothers, our sisters, our parents, everybody. And Kevin and Karen lost a loved one. It's difficult. Karen, you talked about the challenges you've gone through, your family. It touches all of us, and we have an obligation. We've had physical health care for a long time, but we now have to up our game in mental health and addiction care, without question. It's okay not to be okay. We have to have the supports in place to help those who need our help. That's how you judge a society. How do we help the most vulnerable in society? Yesterday, as part of the New Deal with Toronto, we put in a substantive amount of money for homelessness and shelter, $600 million over the next 3 years. 50% of the homelessness are right here in Toronto. And we provided a 40% increase in homelessness prevention program for all of Ontario. So municipalities right across Ontario who also are suffering from homelessness will have the supports. We're going to do more. We've got to do more.
Medicare is where care is based on your needs, not on your ability to pay. Why is it that we all know, and you can speak to this way better than I can, that you cannot have health without good mental health? They are linked.
Connect with us by